Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Farm Health, the Wellness Farm Institute, and Make Americans Free Again. First of all, the food bars are ready to ship. They're made with oatmeal or oats rather, walnuts, chia seeds, apricots, dates, lots of fruit and nut crunch bars, what they're called. They're very filling and they're super delicious. And we ship them in boxes of 12 for $36. If you call the office to order, talk to Kelly about the minimum order for free shipping because you might want to get some other things when you order the fruit bars, but we'll be happy to ship you just a box of them if that's what you want. Okay. Second thing, it's getting closer. The Make Americans Healthy Again Wellness Forum Health Style event that's coming up. 9 hours of health education. It's free, and the dates are June 10, 11, and 12 from 8 to 11. We, of course, will video this. We'll film it so that you can watch it later. I've had lots of people ask about that because I know some of you live in time zones that aren't real friendly to that time and that sort of thing, but we always record it. And as long as you're a member of Wellness Forum, you have access to it like forever, right? Topics will include the controversies about dietary fat and cholesterol, paleo diets, DMSO. Does it have magical properties or is it snake oil? Or someplace in between, thyroid health, discussion about nutrition policy, all this business about seed oils and coloring agents. And I have a lot of public policy experience in the food and nutrition business. So lots of things I can share with you that I think you'll find super interesting and more. All you have to do is send me an email at pampopper@wellnessforum.com and I will register you for this event. And one last thing before we get into the news, our membership drive continues. And if you upgrade your membership or you join and you're not a member, we will give you a certificate equal to your dues, which you can invest in things like the autoimmune disease boot camp coming up, or Winner's Circle, or a new research boot camp I've just scheduled for July 18 and 19. A little bit different flavor of research boot camp where you're going to give me the topics you want us to research. We're going to do it together. I'll go through some basics, but we're going to actually do this together online. So I think you'll have a really good time with this. Alrighty, so any of that stuff is interesting to you, email me, pampopper@wellnessforum.com. All right, so I want to talk about the importance of the microbiome in cancer treatment. Research presented at recent conferences provides some insight into the importance of the microbiome and how improving the state of the microbiome could improve outcomes for cancer patients. Two different strategies were discussed at different conferences, but they both pertain to the same thing. So the first involved designing and manufacturing a microbiome similar to the one that would come from a super donor. And a super donor is somebody who has achieved complete remission as a result of immunotherapy. It's been noticed in previous trials that people with certain types of microbiomes respond better to treatment, and the super donor type of microbiome often results in remission of the cancer. Clinical trials have shown that fecal transplant can improve responses to cancer treatment. A study published in 2021 reported the results of 15 patients in a phase 1 trial who had fecal transplant from super donors. 6 had a response to Keytruda, 1 was a complete response, 2 partial, and 3 remained stable for a year. Stable for a year without progression is not the norm with Keytruda. So the problem is, obviously, there are not enough, unfortunately, super donors, which is why building a super donor microbiome is an alternative. So that's what these researchers did. In response to this issue, a colorectal cancer survivor who had complete response to immunotherapy was identified, and researchers developed a model microbiome based on this person's microbiome for transplant into cancer patients. The researchers reported that they were making a donor-dependent variable procedure that's difficult to get done into something standardized that could be manufactured, precisely dosed, and used in clinical practice. And the eventual goal is to put it in a pill that would only open up when it reached the lower intestine or it could be delivered via colonoscopy. The researchers have applied to the FDA for a pre-investigational drug consultation. And so, to be clear, this is to make the treatments, conventional treatments, more effective. But there's a great deal of evidence to support that that is a thing, that the microbiome state and its composition determines the response to treatments. Now, the second presentation at a different conference involved dietary intervention to improve the response to immunotherapy, and it involved fiber. So, a double-blind, randomized controlled trial enrolled 45 patients with melanoma who were just starting treatment with first-line immunotherapy. Dietary fiber was increased over a 10-week period of time to 50 grams a day in the intervention group, and the low fiber control group was only consuming about 20 grams of fiber per day. So they were both eating some fruits and vegetables, but a lot more with the intervention group. So an evaluation of 20 patients showed that 77% of the high fiber group responded to immunotherapy, and only 29% of the patients in the control group did. So fiber matters. This condition of the microbiome is affected by it because the healthy bacteria, the good guys, who would help you respond to cancer treatment, they feast off of fiber and carbohydrate. So my first response is, duh, eating high fiber plant foods has been shown to reduce the risk of almost all cancers, including colon cancer, and change to a plant-based diet should be the first thing a cancer patient does. And by the way, many of you have heard me talk about Kelly Turner's research. She wrote the book Radical Remission, the 10 strategies that cancer patients who have dire prognoses use to survive. And all of them adopted a plant-based diet, not always vegan, and I'll come back to that in a minute, but all of them. Her point in writing the book is that there were dozens and dozens of strategies given by patients to explain their survival, but they all shared the same 10. And it is statistically impossible for that number of people to have come up with the same 10 just by chance. So anyway, they all convert to a plant-based diet. That's one of the things they attribute their survival to. Second, I want to send a clear message to the people who continue to promote these deadly carnivore diets and high-fat eating. The long-term consequences of these diets are severe and sometimes not reversible. So if you're one of the people who's fallen for this, don't wait until you have cancer to read Kelly Turner's book and change your diet. You can do it now and most likely reduce your risk of cancer a lot. Your microbiome responds to what you eat and prefers plant foods and fiber, as I mentioned earlier. A microbiome built from plant foods is protective against cancer and increases survival for those who have cancer, and is protective against all kinds of things. It was even proven during the COVID debacle that patients who had strong and healthy microbiomes recovered more quickly than patients who did not. So one thing I want to mention, there's a lot of misunderstanding about this, the difference between plant-based versus vegan. We have always at Wellness Forum promoted a plant-based diet. We have never promoted a vegan diet. I happen to be a well-known vegan, and I chose that diet for reasons that are personal to me, but I've never told people that they must become vegan in order to improve their health. The second thing I want to point out is that we don't tell people what to do at Wellness Forum. We show you how to read the medical literature and arrive at your own conclusions. And I will tell you, in 28 years, we've never had people go through the process of learning how to understand the difference between statistical significance and meaningful health outcomes, and how trials of all kinds of things, including diet, are rigged and misreported and that sort of thing. We've never had anybody go through the process of learning all that stuff and then said, you know what, that carnivore diet just really sounds great based on what I've learned. They all 100%, and we're talking 125,000 plus people, have voluntarily, based on the evidence, adopted a plant-based diet. And if they stray from it, they always come back, usually because they have health problems and want to come back home to live and eat a healthy diet and lifestyle so that they can thrive. So once again, learn to do your own research. We can show you how. That's what we do at Wellness Forum. It's not about teaching you what to do. It's teaching you about how to figure out what to do so that the decisions come from you. Just one last thing I'll cover. We have new member workshops. These are open to all Wellness Forum members. You cannot take these classes unless you're a member. Ask the Doctors on Thursday, June 5th. Dr. Tracy Updike, a retired family practice doctor, and Dr. Marcia Shattuck, a retired pathologist, are going to talk about what they know about healthcare, which is a lot. These are two super smart ladies who I am proud to call friends, and I can't wait to turn them loose to share with you all that they know. Another workshop is going to feature another one of our associates, Diana Duganitz, who is going to teach heart rhythms and regulation, the science between heart-focused breathing. One of the most popular books we talked about in the last 3 or 4 years had to do with breathing. So I am super happy to have somebody who is an expert in this area share with you. She's also a heart math certified practitioner as well. And then in August, I will be talking about some basics of autism, both where we know and don't know it comes from and what you can do about it, with lots of time for Q&A. These are member events. You must be a member in order to participate in them. So this would be a really good time to circle back and consider membership so that you can take these classes this summer, and also so that you can use your membership points to participate in some of the other wonderful things we have coming up. A lot of stuff ends up being free for members, so it's a good time to check it out. All right, once again, my email address is pampopper@wellnessforum.com. If anything I said today interests you, send me an email. I'll get right back to you, register you for our free Make Americans Healthy Again Wellness Forum style event, or any of the other things I discussed. As usual, pass this on to anybody who you think would enjoy watching it. And I will be back to you next or on Thursday with more news. Thanks so much for watching.